So hello everyone, and welcome to this episode of In the Know. So we've got a focus on men's health for these series of topics, and particularly we're going to talk today about NHS Health Checks. So before we start doing that, I'm going to just do some introductions. So I'm Dr Sarah McNulty. I'm the Director of Public Health for Knowsley. I work for Knowsley Council. Let's go this way.
I'm Hassan Argommandkhah. I'm the Clinical Director in Kirkby PCN.
My name's Jenkins. I'm one of the physician associates working in Knowsley Primary Care Network.
I'm Mike Fahy. I'm a patient at Roseheath Surgery at Halewood.
Okay, so NHS Health Check. So Hassan, what's a NHS Health Check?
NHS Health Check is about identifying patients who might be at risk of developing cardiovascular disease or diabetes as early as possible. And it's available to any patients between the ages of 40 and 75. So if you're born in 1952, between 1952 and 1986, then, and if you haven't had a health check in the last 5 years, or this is your first time because you've only just turned 40, you can get a free NHS health check via your GP practice. And basically, during the health check, they measure your height, your weight, sometimes your waist circumference. They measure your blood pressure. They test you for cholesterol. And then if you got a slightly raised blood pressure or raised cholesterol, they also at the same time do your HbA1c, which is identifying if you got any risk of diabetes. Obviously, the results of that allows the practice or the healthcare assistant to do what's called a calculation called Q risk. And Q risk, if it's over 10%, that means you've got a risk of having a cardiovascular event in the next 10 years at that percentage. So when that Q risk goes over 10%, then they should offer you treatment, for example, for cholesterol. If your blood pressure is raised, they have to treat your blood pressure. If your HbA1c is raised, they should repeat that one more time. And if that confirms you got diabetes, you get treatment for diabetes. Or you could be in the window between not diabetes and not outside the diabetes, which is called pre-diabetes. And some people call it IGR, your impaired glucose regulation. Mm-hmm. So in that IGR, it's all about diets and exercise and all that. So you could potentially reverse it. But the idea is that if we could stop the progression as early as we can at 40, hopefully you don't go and develop type 2 diabetes with all its complications. You don't have raised blood pressure with complications around a stroke, around heart attacks, and all those things. So that it protects your kidney, protects your heart, protects your body really. So NHS Health Checks is for that reason. It is readily available, and all you need to do is contact your GP practice if you fall in that age group and you don't already have any of those conditions like diabetes, cardiovascular disease, blood pressure, and that sort of thing.
So it's a bit like an MOT, basically.
Oh, 100%, yes. But a good thing is it's only every 5 years. MOT is every year, so it's not too bad.
So it's for people who haven't got those conditions, or they don't know they've got those conditions, and it's because often those conditions like heart disease,
they're
like
very silent.
blood pressure, they can be silent and they can cause problems before you have symptoms.
Yeah.
So, I mean, we've said about kind of how it identifies. I mean, Joe, there's also kind of a bit of an advice session that can go on as well. So if people will get questions about how much they drink, whether they smoke, all of that. Yeah. And that's not just left there. There's an offer of support and help, isn't there?
I think that, in healthcare, we always often say every contact counts, doesn't it? In this case, as Hassan's mentioned, we're trying to identify issues before they become a big issue that we actually need to manage. But of course, it also gives us the opportunity to really touch base with the patient on a human level. If I have a conversation with the patient and they're drinking more than they previously did. And of course, I can see in the past that your weekly alcohol intake was 10 units, and now it's all of a sudden 30 units. Perhaps there's an opportunity for us to be able to have a conversation about why that may be. So, of course, not only is it more about your physical health, but there is also, of course, opportunities for us to have a hand in our patients' mental health or social health as well. Of course, Mike next to me here, he's one of my patients that I actually saw yesterday, not specifically for an NHS Health Check, but we did quite a few of the different aspects of that, the blood pressures, the cholesterol levels, and we had that conversation about how we could optimize him to be able to of course give him the healthiest possible life. And we also, but of course in these appointments we've got a little bit more time. It's not a standard a GP appointment where you've got 10 minutes to talk about things. We have a little bit more time to talk and treat a patient a bit more holistically, and hopefully that was the impression that you received yesterday.
Certainly. When actually seeing yourself, it was quite encouraging to find that it wasn't almost like time driven. It was all about, how you're feeling. Do you feel as though the medicine and your lifestyle changes that have actually had to take place because of my stroke, how is that affecting, my output, my blood pressure? And so we seem to have managed a lot of those things, and it's really encouraging as a patient to hear that and be able to express, how you feel. And, also as well, like I said, there's quite a few questions I asked Joe himself about. I wasn't too sure about some of the, the cholesterol levels. It's quite heavily publicised, but, can you articulate, what constitutes?
What does it mean?
What does it mean? And
And I think as well, in addition to that, gives us as clinicians. I mean, I work full time. Most of us in my team at least primarily work in one location, so we have the same patient cohort as well. So it gives us the opportunity to call you back. So, for example, we discussed and we agreed to meet each other in 3 months' time. Of course, we'll have bloods and we'll have another conversation to see what progress has been made at that stage. So, of course, the health checks and what the information that we get from them, as I say, it's as you mentioned, it's allowing us to pick up on issues before they become something that needs to be worried about, really.
Yeah.
So we know that men are less likely to attend their free health check. We should always say that, shouldn't we? It's a free NHS health check. It doesn't cost you anything. Why do you think that men may be reluctant to attend routine health appointments that are available for them?
One big thing is time. I mean, I don't need to tell people how expensive things are, and I can imagine a lot of people are away working. I can imagine not, prioritising work and family and whatnot over yourself. I can imagine for a lot of men is the reality. Similarly as well, if it's a health check, I can imagine people don't see it as something that's, there's no issue, so why am I looking for an issue? I can imagine. Whereas obviously on the converse, my suggestion is it's not that we're trying to find an issue, it's so that we technically are trying to find an issue, but we're trying to find it so that we can treat it, as I mentioned earlier, before it becomes something worth worrying about.
But it also is important that you find out that your health is good, your blood pressure is well controlled, your weight is within a range, your HbA1c, your sugar control is good, and your cholesterol is pretty on target, and you're eating the right type of food, and having that conversation is really, really important. And I know we are focusing on men, but the free health check is both men and women. So let's not exclude women. So men out there, if you're listening to this program, make sure that you tell your wife as well. They also need to have this MOT. Women tend to have more contact with healthcare professionals because if they get pregnant, etc., they have more contacts, more exposure to the healthcare. But and you just touched on the men working Monday to Friday. In Kirkby, for example, in Kirkby PCN, we're not running a pilot funded by the PCN. Every other Saturday, we have a health check clinic in Kirkby. And if you're registered with one of our Kirkby practices, all you do is contact the GP practice saying that I want to do a health check. They'll check to see if you qualify. And their computers would tell that immediately to their staff, and just say you want to be booked to a Saturday clinic, and then they'll book you in a Saturday. You get a half an hour appointment, you have all the checks done, and actually the way we've set up the Kirkby one, at the end of it you get a leaflet with all the results published and all the guidance and advice to go with it, so you can take away with you a document with all your results in it and what to do, how to improve your life, as well as having the conversation, because in half an hour you hear a lot of things and you tend to forget half the thing. So we'll give you a written piece of paper. So basically your MOT certificate.
Yeah.
And it's got my stamp on it.
But as a patient walking out yesterday, I felt really great, I must admit.
Good to hear.
I was really, it sort of motivated me to carry on with the life changes that I've made and the lifestyle I'm going to lead and stuff like that. But it's also really to prevent any future issues or problems that I may.
Do you mind me asking? Before you had your stroke, was you on any treatment for blood pressure, cholesterol, and stuff like that?
Blood pressure tablets, yeah.
Right. But not on cholesterol.
No. I'm probably at that time probably one of the world's worst for taking tablets. Mm-hmm. So I feel as though that part of the stroke was self-inflicted. The way I led my life, the lifestyle I led, and obviously not adhering to the medical advice that I was given, whereas I've totally flipped that on its head. I eat well, I don't drink anymore, all the things that I've sort of sacrificed, but it's for my future, basically.
So the key message is that have the MOT, have the health check, but listen to the advice, don't just ignore it.
Don't file it away, just act upon it.
And actually there's loads of support out there, so we've got great quit smoking services that are out there. We've got great services that will help you if you have issues with alcohol. If you get under the GP's care, they'll do things to monitor and help bring down your blood pressure. So, all of that. I don't think men are very good at investing in themselves, are they, sometimes, and don't see it always as important to, take that half hour out and just try and help.
I'm probably guilty of that myself in the past. It's like I haven't really invested time in myself. I've waited for things to happen before I've sought help. And
I think a lot of that as well, from a man's perspective, is that you spend so much time investing in everybody else around you. You've got your family to look after, you've got your friends, and I think that at least with me, I know I can only talk about myself and those close to me, but I frequently spend more time in the effort for someone else than I think about for myself, which as a take home for me is something I probably should look at as well, especially because I'm not getting any older. But I think as well, in addition to that, just to kind of bring it back a wee bit, I think the health check as well, it might also just give you some ideas as to what's actually going well, rather than looking for something going wrong. You said you've made changes, and I think one of the things that we spoke about yesterday was that you were really happy and proud that there's some real tangible changes that we're seeing on your bloods. Your cholesterols are coming down, your sugars are coming down, blood pressures are coming down, and all the changes that you've made have been positively reinforced by what I can see in front of me. So I think that it may not be that we're looking for something, it may be that we're actually trying to give you a bit of a sign and say, well, what you're doing is right, and continue doing so. One
of the tricks I do with patients when I'm doing their Q-risk calculations, I often sit them in front of the computer and I say, here's your calculator, and it's at the moment showing you 12% risk. If I untick your smoking, if I untick your alcohol amount, and then press recalculate, the risk suddenly comes from like 12% to 7%. Say, wow, they can see that difference, that my chance will reduce by almost halved my risk. Or, if I get your blood pressure currently from 148 to 128, you can see the risk dropping, cholesterol dropping. They can see all the... So you can actually demonstrate it to them in front of them on the computer by making some changes that you're suggesting that you could happen either with treatment or with lifestyle change. And then they can see the impact. And I think sometimes getting that visual impact to the patient is really, really important.
I think I definitely agree with the visual. I mean, I was drawing diagrams too. I think that's the way... I completely agree with the best way for patient education as far as I'm concerned.
So if we've got some take-home messages from today, what would it be, Hassan?
If you are 40 to 74 and you have not had a health check in the last 5 years, contact your GP practice, arrange for a NHS Health Check. It costs you nothing, and it gives you the peace of mind that you're healthy. And if there are anything that needs tweaking, you know about it, then you can tweak it. If anything that may need treatment, you could start that early treatment. And with lifestyle changes, potentially, you don't have to be on medicine long term. But if you can get everything under control, like if you have too much salt, drop the salt and your blood pressure might improve and you don't need to take medication anymore. But, so these are the things, is catching them early, those interventions. I know you don't like me saying analogies, but it's like going from here, Liverpool to New York. Yeah, if you're going off course and heading towards Bahamas, okay. If at Liverpool you just make 1 degree change, you get to New York. If you get halfway through the middle of Atlantic, you almost got to do a 45-degree turn to get to New York. So that means that the longer you leave it, the harder it is to make the corrections. So the earlier you make those corrections, small adjustments have the dividends.
For the record, I like that analogy.
Yeah, I was wondering where you were going with that one. and then it all came together at the end, if you pardon the pun.
Joe, any key messages?
So I think that knowledge is power in these sorts of situations. I think that knowing about what's going on in your body is, it's invaluable. As you mentioned, it gives you the peace of mind to go to bed at night knowing that you're going to wake up healthy the next day. So I think that at very least it's an educational exercise. It's us telling you how your body's doing and how your performance is. So, and of course, if there's something we can do, then we cross that bridge when we get to it. But for the most part, as I say, knowledge is power.
Mike?
Yeah, I'd just like to say that make sure you go and get the checks. It's quite simple, and it's really benefited me in a really big way. I feel healthier, stronger, fitter, and just my own well-being's certainly improved vastly.
Lovely.
And I guess if if you're going to put your car in for an MOT, then why aren't you putting yourself in for an MOT?
Yeah,
that's a very good point.
Well.
Yeah,
I'm sure Joe doesn't go around kicking the tires.
Okay, thank you. Thanks for your time.
Thank you very much for having us.
Lovely. Thanks, Sarah.
Yeah.